My name is Bishop Dr. William Sifuna. I say Bishop because I'm a consecrated bishop in the police service as the senior chaplain in the service. And I'm the pioneer of chaplains and counseling in the Kenya Police Service, which started way back the year 2019, September 25th. That's when we opened our door for the chaplaincy unit under the Directorate of Personnel. Currently, I'm working at the Jomo Kenyatta International Airport as the Deputy OCPD or PP Sub-Count Commander. But by then, when I started chaplains in the police, since I was employed, I've been a very prayerful man and a Christian. And eventually I grew up in the service, undergoing some trainings on chaplains and counseling because I wanted to help my officers because when I was employed, my first posting was in Northeastern Province. Northeastern Province, I worked in Garissa, I worked in Wajir, and I worked in Mandera as well. And in the process we underwent a lot of difficulties in our services because we were dealing with shifters in those northeastern places. So we lost most of our officers through attacks, and most of them were injured. And then I was seeing what we were going through. I just opted to begin praying for the service, and eventually I opted now to go through some counseling, training so that I could help those officers who are depressed and who have some mental problems. I realize most of the officers normally abuse alcohol or maybe substance and drugs because of the underlying issues. They lacked somebody to maybe intervene and just give them hope. So I wanted to be a hope keeper and also take care of my brothers and sisters in the service. So I've been doing my work in several units, different places of the country. Even I also served the UN peacekeeping mission in Kosovo during the war in Kosovo. And a most advantage thing that I got there is that I was trained in a mission as a counselor. So, and I trained as a chaplain, and I was giving spiritual nourishment to the officers in the mission. And those who have had issues, I had now to sit down with them and counsel them, show them that's not the end, that there's still hope, there's still tomorrow, there's a light ahead of the tunnel. The theme of our unity as counselors and chaplains to serve our community was to restore hope in Kenyans who are affected, to restore hope to our Kenyan market, that the nation is still on. COVID-19 pandemic will not bring us down. So we were to stand strong and make sure that the content we were carrying to the people with the effect of that pandemic was very positive. That pandemic is coming like any other disease, and it is going to leave us living and building our nation. So the issue was of when I called in the councillors for training, and the DIG, the Deputy Inspector General, Kenya Police Service, gave us a permission to hold it at police headquarters because there was no another facility, because most of the facilities were closed down, like hotels and others. They were closed down, unless those hotels were been chosen as quarantines. Other hotels were down, so we had no other facility to go to. So we organized for a big hall. There's a big hall at police headquarters in our basement where we had that training for 1 week training for the counselors in sessions virtually. We were to equip our counselors. Even each and every counselor was, they were frightened. Nobody knew what the pandemic is, but we knew when it attacks you, you can be down anytime, and the chances of coming back to life or maybe stability is 50-50. because we were told if it attacks you, it will leave you when you have some mental problems. So everybody was scared. But as counselors, okay, God has chosen us. God will protect us the way He protected Daniel from the lions den. So we were there to give ourselves hope, energize ourselves, and it's like motivate ourselves so that when we go out there, we know what is behind us is our God. So we also had those skills that we were given to apply when we reach some particular scenarios, like when somebody is totally down, who cannot support himself or herself, we can give a hand support to carry that person to the facility. And those who are stable, we could walk around as we keep this and talking to them until we reach the facility. Those who are resisting, there's a way we use. Even some we were using force, we could call for some, some manpower to use some force. That's why we had some special unit from the police who were going somewhere in some particular estates. If somebody has been diagnosed is down, people are resisting to come out of the stairs. The officers were being equipped by the PPEs, and we go up with counselors to talk to that person first. And if he doesn't, because of the risk of others in the surrounding, we could take that person at least by some reasonable force. And just as we continue giving hope, eventually they will admit as, oh, I was unaware of what I was doing. I really appreciate for you helping me. Because some people could hide, and eventually we hear they have died. And the patients could hear that people who remained in the homes, they are dead. And with them in the facility, they are now surviving and they are getting well. So at times, as we said, resistance was there, and what we carried was to give everybody the service that it deserves. If somebody is cooperative, we cooperate. If somebody was resistant and the government is saying everybody who is positive should go to the quarantine. So we made sure that police officers will use the necessary force or necessary action to make sure that we have secured others from that effect. Because we have people who are careless. Even during that time, we could find people who could hide in vehicles and drink meat and talk and drink in somewhere. And then they infect one another with COVID-19. And eventually now they come to the estate or maybe in the compound to affect the family or affect the neighborhood. And once somebody has been recognized, when used in Nyumba Kumi kind of networking, if anybody is affected, the call center was there, they could call. And then the nurses and the doctors and the police would rush there. We had vehicles from the KNH that had been set aside to rush into places where we are called. And when somebody is found, they are tested, they are there. If they test, because those facilities were very instant in testing. They test you just there, and they get you. And even we could, after having such a person, we could also test the surrounding, all other people who are there, they could be tested. Those who were positive, we fish them away. At least that's how we managed. So there was use of some force, there was use of some, and some people could even volunteer to come by themselves. Even when they feel those symptoms, they could just come or maybe call and say, I'm feeling this and this and this. I said, okay, we are coming. So the nurses were there, those who are dealing with the testings, they go and test with the facilities. And then, okay, if somebody is testing positive, they say, bring a vehicle. We were having those special vehicles that were sanitized, and they were having some special nurses who are assigned for that effect. So the message was, or maybe the content was, we need to have people. We needed to have people who are on the ground to counter the menace. And those are the counselors from the police, MOH, and other counseling facilities. They donated their people to come. And some people, even there are some organizations, counseling facilities, they donated their facilities for quarantine. And we allocated some officers and some counselors to go there and help them. And by so doing, we also had officers on guard who could now patrol those areas of facilities. Nobody should run away and nobody should enter without any permission. So we had officers on guard. Most of the officers from the APS, National Police, they were all over everywhere to guard and also prevent and manage the facilities. And we were there. We have several counseling skills But during pandemic, we adapted one, telecounseling as a skill. Telecounseling worked much for us because telecounseling means you use some gadgets like let's say format of you using WhatsApp or phone call, or maybe you use screens. Like during the when the pandemic was so tough everywhere, in major quarantine or holding centers like Mbakati, Jomo Kenyatta National Hospital, and even Kenyatta University Teaching, Referral and Research Hospital, then Moi Teaching and Referral Hospital in Eldoret. Those were the national quarantine centers. We could put screens. The IT people put screens for us, so you talk to them when they are watching the screens, and you are in a different room where you are facilitating, so that you should not even now be in contact with them. And at times there are some others who could see you, but there was some a transparent mirror. They saw you through the glass. They're on the other side, you're on the other side. So when you speak, they don't hear. So you use a gadget. You use like a microphone, and they connect some speakers. So you talk to people, they see the gestures as you are talking to them, but you are in different side. So that's a telecounseling. Anything that came each and every day, it has its own content. We could now attach it, or maybe attack it the way it's supposed to, or maybe approach it with a lot of cautiousness and a lot of wisdom. And that's why, and we are only praying together all the time. In the morning, before we begin, we pray together. During the lunch hours, we eat, we pray together. And in the evening, before that break, we pray together. And that was the trend, to say, God, forgive us and heal our land. As 2 Chronicles stated, for those people who pray and seek, call upon my name and repent of their sins, I'll hear from heaven and heal their land. So we were praying and seeking God to forgive us as Kenyans, and forgive Africa, forgive the whole world, that we should not be swayed away. And God heard our prayers. Now we can enjoy to speak as we also pray for. We are now proactive, praying before things happen. We are praying for God to maintain that protection upon us. And as we serve as Kenyans and maybe as police officers, we are praying for God to elevate our standard of service to our humanity and maybe to our public. Yeah. Thank you.
So my name is Dr. Mutua Mbuvi. I am a medical officer working at the Kenyatta National Hospital. I think the beauty about being in KNH was that they were able to quickly, we had a COVID theater. So we had a theater that was specifically dedicated to handling any surgical cases for patients who are COVID-19. And I think that was, it's one of those things that you sit back and you look at it and you go like, yeah, that was a brilliant idea. And even the doctors were working. So it was not only now an infectious disease unit illness, COVID-19, it don't only belong to the infectious disease people, because now we had to incorporate all these other people. We had to talk to the surgeons when they were going to do their surgeries for the patients with COVID-19. The surgeons also had to come and review those patients who surgery had been done and they have been admitted into the COVID-19 unit because they have COVID-19. The surgeons have to come and keep their daily reviews in terms of the surgical aspect of it, while we take care of the COVID-19 aspect of it. We still had our critical care specialists who are now the ones who are helping us in terms of handling these cases, the patients who we have in the ICU. We had a good team of pulmonologists, specialist doctors for lung conditions who are there with us, and they will actually, give us the step-by-step of how we're going to sort out these illnesses for these patients. What do we need to do? And the coordination all the way to, let's say, like the radiology department for patients who required chest x-rays or required chest CT scans to see how badly off they are. We had a system for them that they will actually go, and the radiology unit will be prepared. There will be guys ready for fumigation. So once the patient has, the scan has been done and they're heading back to our unit, the fumigation team comes in, they fumigate the area, give it time for it to dry up and settle, and then the rest of the system continues. Yes, it presented a challenge. yes, there were many interruptions at that time, because of course if a unit has to be sort of like stopped for a COVID-19 patient to be sorted out, and then it has to be fumigated, and then now continue again, of course there's time that is lost in between. But at that time there's really nothing much we could do, and we were just trying our best to see how do we still give the quality of care that KNH is known for to these patients without, in as much as we might inconvenience others, but even for them to understand that we are now dealing with a pandemic. And the thing about COVID-19 was that it was not discriminatory. It will not decide, today I'm picking him, you, I'm not going to deal with you, I'm going to jump to another person. As it was affecting everyone equally. So even the patients who are coming in, even the measures that were put in place in the hospital in regards to reducing the number of visitors who are coming in to see patients, people actually took it well, because they understood that the mandate of the hospital is to ensure the protection of the patient, to ensure the protection of the healthcare workers who are working here, and also you who is coming to visit your relative or your person who's admitted, we also care about your safety. So in as much as we are telling you that we were only allowing maybe one person to come and visit, or two people at most, I think a good number of the people who used to come and see their patients actually understood, and they knew why we were doing that. And also the same thing, our communications team did a very good job in letting them know this is the reason why we're actually putting these measures in place, because we want to ensure our patients are protected, our healthcare workers are protected, and you as well as the visitor, you're also protected. That was the interesting thing about it. So when you're looking at that aspect of how we helped the patients who had COVID-19, KNH did its part. But then now we come to the area of what KNH did for its own people, its own healthcare workers, because even healthcare workers were not immune to COVID-19. So at some point, as we were going through the daily challenges of COVID-19, healthcare workers started getting affected. So now we had people getting affected, and not necessarily people who are working in the COVID unit, but even people who work in other areas of the hospital. Because you leave the hospital, you go to your home. You'll meet people on the matatu on your way home, or you'll bump into people in the supermarket and you're buying new things. Someone will sneeze, will cough, you get COVID-19. So now we started getting healthcare workers who had COVID-19. So now it became, okay, so this is an interest, this is something new. So what do we do to ensure that we take care of our healthcare workers properly? So the first thing that was done, there's a building next to our accident emergency department. It's called Daycare Center. So the Daycare Center was now fully, equipment was taken in, beds were taken in, and then it was designated as the Healthcare Workers Isolation Center. Because we did not want to mix our healthcare workers with other patients who we were seeing. So at least we wanted to have that demarcation between the two and look at ways how we can be able to work on both sides. So the Daycare Center was opened up, and now we started admitting healthcare workers, and not only healthcare workers who work in KNH, but even healthcare workers from within Nairobi, and I think also Kiambu County as well. We used to get healthcare workers who were brought in for isolation purposes, and even if they needed any other medical management or any other interventions that were required, the hospital took care of it. So now we had that unit where now we were taking care of our healthcare workers. And as luck would have it, I was moved from the intensive care unit and taken to the daycare center, where now my primary mandate was now to take care of our healthcare workers. And for me, honestly, I think that was one of the absolute joys of working in the COVID unit at that time, because now I was able to give back to the people who are actually on the front line, the people who actually, we were in the trenches with them, and now I had the privilege of being the person, together with a team of other doctors and nurses, to take care of them. And we were able to look at the protocols that were being developed at that time for now, how do we quarantine or how do you isolate people who have COVID-19? What are the parameters? How long do you need to keep them in hospital? After how long do you test them? How many tests do you require? Because from the time COVID-19 started in 2020, all the way till, I think towards the end of 2022, on the end of 2022 there, the protocols kept changing. Initially, it was, you get isolated, we do a COVID-19 test, the first one, if it comes out negative, you stay with us for another 48 hours, we do a second one, and then if the second one is negative, we discharge you home, but you go home at least maybe for about, I think it was about 14 or 21 days of home isolation, and then slowly you can now integrate back into the community. And with time, it changed as COVID continued to evolve. Those parameters changed to a point where now we got to a point where it was just now the isolation was done. We only needed one test to confirm if you're negative, and you didn't have to go home for home quarantine. You could maybe just take a day or two off work, and then you can report back to work. So that was the other part of now working with the healthcare workers. And also now, specifically now for KNH, for our staff who are getting COVID-19 but did not require isolation, because at that time now the protocols are also changed on who can be isolated, who doesn't need isolation. So for the ones who did not need hospitalization. So for the ones who did need hospitalization, we actually opened up a day clinic for them. So they will come, I will see them, and we'll talk about what symptoms they're experiencing, how they're coping with the medications. And most of the time, the medications that we will give are just basically for symptomatic management. If they have headache, if they have joint pains, give them some painkillers, such things. And the other things that we were giving, like vitamin C and zinc. So we will give them that, and I will give them a return date for them to come and see me, and then we will talk about how the experience is. And if they're ready to go back to work, we'll sign it off and they will be back to work. So that was also another part of the good thing about talking to healthcare workers at that time who were actually infected with COVID-19. And we worked at that place, kept the day clinic going on, and we would see our healthcare workers. And then a year down from now, around 2021, March 2021, because it was almost like a year exactly since the first case was identified, COVID-19 vaccines were now available. And that also became another game changer. And so at the place for daycare, we decided that's going to be also the place where we're going to be issuing out the COVID vaccines. And obviously, among the first people to be taken for the COVID vaccines were the people who were actually working in the COVID units, because we needed to have that first, and then the rest of the people in the hospital came in. And the uptake for the COVID-19 vaccine was actually quite impressive. We used to have long queues of healthcare workers, even just not from KNH, but even from different facilities who are coming to get the vaccination, because the vaccination was being provided for free by the government, which was actually a very good thing, if consider that we were dealing with the pandemic. And the vaccine also became a game changer, because now for us as the guys who are actually on the trenches, we were now like, okay, there's hope now. There's actually hope. Because we were always wondering, when is this thing going to end? Or is it not going to end? Are we always going to be in this perennial state of being in masks, ensuring that everything that you do is in line with protocols in terms of prevention, in terms of hand wash, in terms of hand hygiene, in terms of all these things? Is this life now? But now when the vaccines came in, it was such a good lifeline. It was hope. It was hope, and we were actually able to sit down and go like, whew, okay, now we have something. We can actually start moving forward, and you can actually start looking forward to a point where we will no longer be in this perennial state of just fear and constant wondering of when is this thing going to end. Yeah, so the vaccine became a very good thing for us at that time, and it also helped that now, even as time went on, the number of cases also started going down. The government started loosening some of the restrictions like curfews and everything, and slowly by slowly we started seeing the country basically as a whole started slowly going back now to what they call the new normal, and being able to have lived through that experience from the very first case all the way, seeing how the different intricacies of how the healthcare system was really tested at that time, in looking at how we, as a healthcare system, how we were able to coordinate, not just as KNH as a hospital, but also with other facilities, and how as KNH we were able to help other facilities also, bring up the game in terms of how they're handling COVID-19. And one of those initiatives, which was actually very, one of the good things in terms of knowledge sharing and capacity building, was that the KNH team from the research side started webinars, which used to happen every Friday. It used to happen every second Friday. Actually, every 2 weeks on a Friday, we will have a webinar where, as KNH, we will present what currently are we doing in terms of taking care of patients of COVID-19. What are the new things that we are trying? What are the different things that we are trying? And slowly by slowly, this webinar started involving now people from the Ministry of Health, started involving counties, started involving other private hospitals, and people would actually come and they'll give a presentation. Let's say, like, for example, Kisumu County will come and give their example. They'll say, yeah, these are the number of patients that we have seen. This is how these patients are presenting. These are the main symptoms. This is how we are managing them. These are the innovations that we have come up with as a county that help us in terms of managing these patients. And someone from Mombasa County will give a presentation on the same, and they will say how COVID-19 is affecting a particular sub-county in Mombasa and what interventions is the county government together with the national government doing in order to just help mitigate the adverse effects or the adverse outcomes of COVID-19. It was such an interesting place of knowledge sharing because it had everyone from our senior consultants in infectious diseases to other consultants in other fields of medicine and surgery, and also now our regular people, our medical officers, our nurses, our clinical officers, anyone who at any given time was handling a patient on COVID-19 would be able to join into the webinar and actually just, pick up some bits and pieces of knowledge, know what to do, look at the new things that are coming up. And one of the things that really excited me at one point was at our Mbagathi facility, we realized that the patients who we had in there, because they were being quarantined for some even for more than 2 weeks, some even for a month. And because of the strictness of the measures, they had to be kept inside the ward. But we noticed that the more we kept keeping them inside the ward, and these were normal people, they were healthy to some extent, it's only that they had COVID-19, they just needed isolation. But if you keep them locked in one place, it also affects their mental status. And one day we organized for a Zumba class for them, and they were actually able to now come out of the facility just to the grounds of the facility, and they were able to do exercises and just interact with one another, dance, do a bit of exercise with the instructors and things like that. And from that, we actually noticed that by giving them a chance to actually be outside of the ward, to be actually outside and actually, enjoy the fresh air, breathe in the air, sit outside, bask in the sun for a bit, and allowing them that space to at least, if I can put it like stretch their legs, was actually a very big impact for them. Because some of them are actually saying, I've been inside this ward for a very big period of time. I just want to go outside and just feel the sun on my skin. Just allow me to carry my seat and just sit outside there and just take a breather, enjoy the air, enjoy the sun and all these things. And it was nice. It was good to see that. And as a doctor, personally, it also, and like I said, it showed me the aspect of how important our mental health is, not just for personal, but even for people who have illnesses and things like that. For people who have illnesses and things like that, but even for people who do not have any illnesses, because as part of the WHO classification of what health is, mental health is actually a part of it. It says that it's not merely the absence of disease, but it's also your well-being in terms of your mental health, your physical health, and your emotional health. So that's what we call health, as in good health in general. So we were taking care of their physical health, but then now we understood that now we also need to put in the aspects of your mental health. We need to look at how well are you coping with this disease? How are you going to cope once you have left the facility? Because if we go back to the people that we had in the facility, many of them lost their jobs. Many of them lost their houses, because some of them will stay there for a period of maybe a month, 2 months. They have not paid rent where they were. They do not have an income they can't generate an income when they're inside the facility. So they can't have money to pay outside. So there were so many challenges at that time for those people, for the patient that we took care of there. And one of the things I think that was a major win for KNH is the fact that the treatment for COVID-19 was absolutely free. None of those patients were actually charged. So everyone we will treat, we will give you medication. Once you've become better, we have done the tests, you're negative, we will discharge you home. You will not be asked to pay any amount of money. And even if you ended up in our ICU, you required even surgery and things like that, as long as it was COVID-19 related, the charges were not there. And that was, for me, another big win for KNH, because we were able not only just to take care of the patients we were seeing, not just for their physical health, but also help them in terms of their mental, and also to some extent their financial side of it, such that they did not have to think about raising money to pay a hospital bill, which would have been a significant amount of money. And most of the people who had actually been admitted there were not people who, some of them actually came from what I'll call low social economic status, so they will not be able to really afford, to be very hard for them to actually make the payments. But as KNH, we were able to offer services to them, and proper top-notch services for them, and we were able to discharge them, and they went home. And those are some of the small things that I consider to be our biggest victories as KNH in terms of how we were able to manage COVID-19, to the point where we kept improving on our workings, we kept improving on our infrastructure. So to a point where even KNH now actually acquired its own COVID-19 testing machine. We were now able to do the tests in-house, which also meant that we took a shorter time for us to get our results, rather than waiting for, let's say, the National Influenza Lab or maybe KEMRI to do the tests for us and bring fast back the results. So this also helped us in terms of reducing our turnaround time for the patients who we were with, even for the people who are just coming to be tested as outpatients. They will just come and just want to be tested. They're tested and they can get their results within 12 hours, 24 hours max. And it was actually a good thing for us. So from my experience of what we went through as a country and what we went through as a hospital, for me, it showed a side of humanity that is rarely seen. Okay, not rarely seen, but is not really seen that much in the healthcare space. We deal with conditions that have been there for a long time. The diabetes, the hypertension, the malaria. We know how to manage them. We know how to deal with them. We have protocols in place that have been effective, and they have run and they have done their work tremendously. But now, we were faced with a disease that no one knew how to handle, that we had to rely. We were looking at what China was doing. We're looking at what Europe was doing. We're looking at what US was doing. And then we realized that we also need to look at what can we as Kenya, what can we as Kenyatta National Hospital do in terms of management of COVID-19 in our country? Because even if you look at the statistics, and we thank God again, we did not lose as many people as the rest of the world, as the people in India, people in China, Italy, Spain. We did not lose that many people. So there was that thing of, okay, yeah, there must be something that we did right. There must be something that the government did right, in as much as people maybe protested a lot about the curfews and everything and the mandate to wear masks throughout. But it actually, because as healthcare workers, we actually saw the effects of those things. The numbers actually went down when these measures were actually put in place, where there were stringent measures about how to put on a mask, hand washing, quarantine, reduced socializing. It actually helped to curb the spread of COVID-19. And that is just from personal experience, from what we saw, and in terms of our statistics at the hospital, in the number of patients that we will get. And when restrictions were eased a bit, there was usually a spike in the numbers of patients that we will get, and then the measures will be put back in place, and then the numbers will go down. Yeah. So that was basically those 2 years of, in summary, of working in the COVID-19 unit. Yeah. So COVID-19, the pandemic, taught me a lot about collaborations, taught me a lot about the importance of research, especially in the healthcare space. And the main thing I can say is that it taught me to actually relate with my healthcare worker colleagues, the people I work with in KNH, and not just to see them as my colleagues, just to see them as, this is the doctor that I work with, this is the nurse that I work with, but actually to understand that at some point we're almost like a family. As KNH, we're almost like a family, because if I'm not there to assist you and you're not there to assist me, probably we'll both fail. But COVID-19 showed us that we can actually work way better. We can actually do teamwork way better, and not just from the ground level, but also all the way from the board to the senior management, to the management of the hospital, and then out to the rest of us who were considered to be the foot soldiers at that time. And it also showed me that if you have, like I said, if you have the people who are propping you, the people who are supporting you from behind, the people who are holding your foundation, if you have a strong team that is doing that, your foundation is solid, there's nothing that you can't do. And I saw that firsthand from KNH, from the support that you got from the management, the support that you got from the Ministry of Health, from the government, in terms of just allowing us to do what we do best, in terms of providing quality healthcare was amazing. And being in the COVID-19 unit was also an inspiring thing for me as well. As a doctor, I'd never thought I'd find myself in a situation where I'll be dealing with a disease that would have so many aspects to it. But it was an excellent learning experience, and I believe it has actually shaped my medical career for the better. Because I learned a lot during that time, and most of those lessons are lessons that I try to use on my day-to-day practice as I continue to practice as a medical doctor. Frontline colleagues that we worked with, wow. Honestly, the best team you could ever work with. I had a team of from the specialists to now my colleagues, the medical officers who we worked with. It was a big team because we had several areas where we were handling COVID-19 cases, and we all came together under one umbrella under the infectious disease unit. And we had an amazing team, people who were dedicated. The doctors were very dedicated, the nurses as well. And I think there's some people who the spotlight never really shines on them a lot. We have the doctors, the nurses, the laboratory people who are handling the patients and doing the tests and everything. But there's a group that I believe, if it wasn't for them, our work would not have been as easy as it was. And this was, I'm talking about our support staff. The people who came in with us into the unit, they were responsible for cleaning the unit. They were responsible for disposal of the garbage, disposal of infectious materials. They were responsible for just ensuring that the environment that we were working in was actually top-notch. It was actually clean. It was up to standards in regards to public health measures. So those are the people I think sometimes they tend to be forgotten because everyone tends to look at the highlights, the doctors, the nurses, the lab techs and everyone. But we had an excellent team of public health and support staff, and even the people from the kitchen who used to bring food for us and even food for the patients. As in, it was such a collaborative effort that not one particular cadre can be given the full accolades and told that you are the guys who did the best. But we had such a big team that included so many people, and even not just from the clinical side, but even from the administrative side, because you need administrators to ensure that supplies are available. You need administrators to ensure that the equipment that you need is there, and you need security. You need security personnel to ensure your protection, to ensure the protection of the patients, to ensure that we do not get any attacks from outside or from within or from whatever. So all these people who worked in the COVID unit, everyone from the doctors to the support staff, in between with security, catering, all these people, I think had the best team. We had a really dedicated team of people who are working in that particular facility. Yeah. So mine is just to, if they ever get to see this is just heartfelt from me. Thank you so much. You guys made us who we are. You guys pushed us and pushed KNH to levels that no one would have thought we would get to in terms of managing a pandemic. Yeah, and we did, and we thank you for that. We also appreciate the fact that the Ministry of Health and also the government at that time really saw the work that we did, and at some point we actually some of us were actually honored by the president to be given the Uzalendo Award for the work that we did, and many of my colleagues were within KNH who are part of the recipients, including myself. And it felt good to be recognized, it felt good to be appreciated, and so I just take that time to actually appreciate the other people who actually helped us to get to that level that we did. Yeah.
My name's Audrey Chekurotich, working at KNH, Kenyatta National Hospital, as medical laboratory technologist. My specialization is in microbiology, which deals with the infectious diseases. I started working at the Ministry of Health back in 1994 when I was newly posted at the Nakuru PGH. And then later on, I went to Coast General, worked for some years, like 10 years. And then later on, I just came and joined Kenyatta National Hospital in 2010 till now. First, I heard about the COVID-19 in 2020 March through the media, and when it struck the China, and that's where we saw many people dying. But we didn't know that it will reach our country. Yeah. So after some few months, we found some cases in our country, and I was nominated to join the team which was working in Bagadi Hospital. So when I reached Bagadi, there were a few patients who were there, the patients which we were already admitted there, and some health workers from KNH, from different departments. So as a laboratory, there were nobody who was represented by them. So I went there and waited for some people from other facilities now, like the national laboratories. But good enough, there was one lady from Cambridge who came to our rescue. She came and then she took me through the training. So we did the donning, the doving, and showed me how to remove the samples. So after the training now, that's when we started the sample collection. And by then, we used to work until very late. We had not started by then doing the testing from our part here, from KNH. So we used to take our samples to Cambridge. We used to pull the samples until maybe in the evening at around 6:30. And then we had a vehicle from Cambridge which came to pick the samples and then to do the analysis. At first, I could not tell anybody about me working as a health worker under the COVID team. In fact, speaking about KNH itself, it was a stigma. So we used to just keep quiet, don't tell anybody about the place of work. So about my relatives. At first, I didn't. In fact, we had to hide the information to our parents because to them, I think they could get worried more, and they were already. My parents were older, so I could only tell my brothers about me working as a health worker under COVID, and also within the place of work, there was a lot of stigma. People used to tell us, as in when you were walking along the corridors, they could be told that person working under COVID that they could move away from you. And at some point, being the team leader of COVID under a laboratory, when I used to come to collect the consumables, the first time when they heard about Audrey, you know, when the name Audrey was all over in Kenyatta. When they heard about Audrey within the environment, maybe at the stores, you'll be the first person to be stabbed to collect your consumables. Made that you can go away from them. I and my husband got infected, and I was so worried. When you get the infection, there was a thing when you cough, there's something which cuts the breath, and you could feel you are just to die. You cough, there's something which cuts the breath. I don't know what was happening with that disease. You know, you can imagine how people were dying, and you can see now we yourself now as a health personnel who are infected. So I could think maybe I also die, and maybe I leave my family, a young family. I had my son. So that was what was worrying me a lot. I can remember at some point when he was in the ward, me myself I am at home. Him is in the ward, and we were not allowed to go and see him. So at some point you could call him, and he used not to pick the phone. So the worst thing you could think of is that he was no more. That was the thing that was worrying me. And I'm at home, I could not come to Kenyatta to go and to come and check him. So anyway, it was good. we thank God for that. At some point, as people, we used to go to the wards and pick the samples from the patient. At some point, we used to get attached to them. So when you heard about a patient who we just lost there, we didn't got affected as our sense. Could imagine person was speaking the other day, you were just some of them came when they were not that sick. But now, at some point, maybe when the infection gets deeper to them, you could find maybe they have died. So, at some point, you are affected as a health worker because you've lost somebody. One of us who was working here told me later on how encouraging. Yeah, I don't know how I used to talk to them, but being a medic is all about being strong for others. So being the team leader, I can just say that when we used to work as a team and encourage them, that this thing we are going to conquer. I can say we were so happy when we found that the percentage of infections was going down. They were having few patients. The work was not overwhelming. So it was a plus to us. In fact, we were happy when we realized that the disease was going down. And the mortality rate was also going down. We did a good job as a team, and we were happy about it. I came later on and got an award after some months working under COVID. And I got a prestation award. And I can remember when the boss, my in charge, set me there, I really got demoralized. I asked myself, why did he choose me to go there? And I could remember him encouraging me. And I just go, don't worry, maybe one thing will come after this. And for sure, when I got an award, I really came and thanking. Yeah, it was something which I knew that it was like, was this boss sending me to go and die? But now when I got an award, I came and I appreciated why he chose me. Yeah, I've really gotten a good experience in how to handle the infectious diseases, on sample collection, on packaging and transportation of these infectious diseases. That's what I can say about the knowledge I got, which is very important to me because I can work even in the international world when there's any infectious diseases.
My name is Amisha Kijiro. I come from Githurai 44. In fact, that is the place where I do my work, and also I resigned that place. There was a lot of worry because even me personally, that thing created a lot of fear in myself personally. So you can imagine those people, especially those people who are in health centers. I can say that these people, in fact, they did something that was so encouraging, because to deal with these sick people and that things could even compromise their life. So these people, really, I thank them for what they did, because that work is a God given. Yeah. Because they did that work despite a lot of dangers in that work. Yeah.
My name is Jeremiah Mwagi Muturi. I am from Murang'a County, Kigumo Sub-County. Mimi ni mwanabiashara. Kuna mtu mmoja rafiki yangu ambaye alikuwa mgonjwa wakati huo. Alipelekwa hapa KU Hospital. Wakati huo hata kwenda kumuona ilikuwa ni shinda. Mnaogopa, hata kule ward kuingia hata kuogopa ni shinda. Hata kama una sanitize pia unaogopa, kwa sababu hujui virusi viko wapi. sana sana wale watu ambao nilikuwa na wahurumia, na ndio nasema hawa watu wanafanya kazi ya Mungu, hawa madaktari, nurses and doctors. In fact hawa watu walikuwa hatarini. Unajua, ndio tulikuwa sasa tunaangalia watutibia hawa watu na hawa watu ambao walikuwa wanakuja, wengine walikuwa na virusi Sasa those people walikuwa na riski kubwa sana, lakini walijitolea, Mungu akawasaidia, tukiwachukua kwa utu. Hawa watu wanafanya kazi kubwa, na hata sio wakati wa COVID, hata wakati huu mwingine. Unajua daktari ama nurse ndiye tunampelekea mgonjwa na hata yeye ni binadamu pia kama sisi, na anaweza kupatwa na huo ugonjwa riski yao iko juu sana. Hiyo ndio ningesema kama maoni yangu.
So my name is Cedric Iravo Indago. I'm from Western, currently stay in Kawangware. The nurses, I would say they did their best, and I would say thanks for them. They carried the situation, and yeah, they saved lives.
Naitwa Lucy Wairimu Njeri kutoka Murang'a County, lakini naishi hapa Nairobi. Nakumbuka wakati wa COVID watu wengi waliathirika sana na hiyo ugonjwa. Wengi wetu walikufa, majirani zetu walikufa tukiwaona. Hata katika familia kuna wenye walikufa na tukaona wamekufa. But tuseme pia madaktari walifanya kazi yao vizuri, kwa sababu tuliona vile walifanya kazi na bidii. Waliweza kusaidia watu na walifanya kazi vizuri, na tunawashukuru kwa vile walikuwa wanafanya kazi yao.
My name is John Bugwa Waithaka. My resident place is Githunguri, Kiambu County. How I can remember COVID-19, it was like a tormenting spirit in the whole country or the whole world. At that time, people were distressed. Business were shut down. Everybody was mourning. Nobody was knowing what to do. Everybody was in a dilemma. The whole country, the government itself. But all the best, God worked for us and have mercy for us. And I thank the management of the healthy facility, all the management they took place. It was a situation where everybody was in danger. At that time, everybody was in great fear, fear of the death, fear of knowing what is going next, what will happen next. But I thank the ministry because it informed everybody how the situation is, and the government came to intervene in that, and all it's well.
Kwa majina naitwa Rahabu Wanjiro, mimi ni mkazi wa Nakuru County. Tuliona vile madaktari walijitolea upande ya hiyo COVID-19. Wenyewe wakati huo walifanya kazi mzuri sana. Walijitolea kabisa. Walijitolea vile wanaweza. Na watu wengi walipona kwa vile walijitolea kwa kazi nzuri walifanya wakati huo.